Hello everyone, I am Dr. Hamza Sheikh, spine consultant and scoliosis surgeon. I work at Manipal Hospital, Dwarka, New Delhi. Today I will be talking about spinal fusion surgery. So basically our spine is made up of 33 small bones, and between two bones there is a disc. Because of disc and this joint between the two adjacent bone, which permits some mobility and maintains the spine's stability. So in spine fusion surgery, basically fusion means, in Latin word, means to melt together. So what we do in a fusion surgery, we fuse or fix two adjacent bone with the help of putting some screws and putting a bone graft or bone graft substitutes to make or to unite these two adjacent bone together. So now question comes, what is the advantage of doing this spine fusion surgery? Spine fusion surgery helps in relieving the back pain and leg pain by decompressing the compressed nerves, and other is to maintain or regain the spinal stability. So when it is done, indication of this spine surgery, or when this surgery is indicated in the some of the following spinal pathologies, such as spondylolisthesis. Spondylolisthesis is basically when this spine, when we see from side, are in a same straight line, but in spondylolisthesis one bone slips over the other, which hampers the spine stability, and whenever patient moves, feels the pain because of pinching of nerve also, and because of the spinal instability. And other conditions which hampers the spine stability are tumors, spinal infection, and sometimes we need to do the fusion surgery to correct the deformity, such as to correct the scoliosis and kyphosis deformity. So what patient can expect during this surgery for spinal fusion surgery? In such cases, we normally do this spine fusion surgery now in two types of techniques. Types of spinal fusion surgery based on where we are putting the graft and how we are doing the spinal fusion surgery can be a posterolateral fusion. That means we are putting the bone graft on the posterior part of the bone spine, and if we are putting the bone graft in between the two bones, it's called interbody fusion, and that can be done from a back, called TLIF or PLIF surgery, and if we are approaching the spine through the abdomen, it will be a ELIF surgery. And how we are doing with the traditional open surgery technique, or we are doing through a latest minimally invasive spine surgery. There are a lot of advantages doing the fusion surgery with the latest minimally invasive surgery. The rehabilitation and recovery of the patient is very fast in the minimally invasive technique. Normally in both of the surgery, normally patient requires admission for 1 or 2 days, but with minimally invasive technique, if we are using, the patient to getting discharged and go home and become starting living a normal life is little early compared to open technique. So what protocol we normally follow for a spinal fusion surgery, we admit a patient and do the surgery maybe on the same day, or we admit the patient one previous night, and we do the surgery, and most of the patient after the surgery starts walking on the very next day of the surgery, and walking and out of the bed is allowed immediately after the surgery on the next day. And normally we admit the patient for only 1 or 2 days, and if we are doing the surgery with a minimally invasive technique, normally patient will get discharged within 1 day. And after the surgery, when we discharge the patient, we ask the patient to come back on a 5th day of the surgery for dressing checkup, and on 14th day of the surgery we normally take out the sutures. So now there are some do's and don'ts which we normally tell our patient after a spinal fusion surgery, is that patient are allowed to walk and climb downstairs and sit on a chair, but they are not allowed to bend and lift any heavy object and sit on floor for at least 3 to 4 months. This is the normal expected time for fusion to happen. So that's why we tell our patient that they are allowed to walk and do the sitting, but not allowed to sit on floor and lift and bending. And what patient can expect after the spinal fusion surgery is the dramatic improvement in the back and leg pain, and by decompression of the nerves and regaining the spinal instability. After the surgery, in 5 to 6 months, patient mostly able to do or carry out all his activities. In fact, can start doing the sports activity also. For any queries related to spine fusion surgery or any problem related to spine, you can contact spine department at Manipal Hospital, Dwarka. Thank you.